West Metro has implemented a new protocol to change how we respond to these type of emergencies. Once a patient has been screened through dispatch to possibly have COVID-19.
JeffCom 911, what is the address of the emergency?
When they take the initial complaint, if anybody calls and says, I've got difficulty breathing, flu-like symptoms, I have a fever, that's going to trigger a separate set of questioning that they're going to go through with the caller. And that's going to ask specifically, do you have a fever? Are you having a hard time breathing? And then the travel question, have you been outside of the United States in the past 14 days to some of the target countries where we're seeing this infection? If any of that comes back as yes, even if they say no to the travel piece, but they say yes to difficulty breathing and a new onset fever, we're going to try to get more information and we're going to presume a level of infection, and we're going to take the appropriate precautions.
Engine Medic 4 on scene.
Once we get on scene, you might see us parked out in front of your house and not immediately come in, and that's okay. We're actually going to try to get you on the phone and go through another kind of deeper questioning process to determine if in fact we believe this is a COVID-19 exposure. If it is, then that really sets the stage of how we're going to come into your house. There might only be one or two of us, and we're going to suit up in all our protective equipment. So goggles, face mask, N95 respirator mask, and gown and gloves at a minimum. And then we're going to really limit how many people we send in. So we'll walk into the home, we'll make verbal contact with the patient. Depending on where they are, we can kind of toss them or hand them a respirator mask to at least put on themselves, so we can limit, if they are coughing, we can limit that droplet exposure. And then once we have that, we can start the questioning and determine, can we treat in the home and leave them at home, or is this something we actually have to prepare for transport? If we have to prepare for transport, then the people that are remaining outside, we can say, please set up the ambulance to make that kind of isolation zone for the patient, and then they can start that process outside. When we start to prepare an ambulance for transport of a suspected COVID-19 patient, we're taking some precautions as to the exposure in the back of this ambulance. So what we're trying to do is make the back of this ambulance a isolation room that we can safely transport the patient and our crew to the hospital for care. So a couple ways we're going to do that is, you'll notice there's nothing on the countertop. So any of the equipment that we would have out, that's all going to be put away on scene before we bring the patient into the ambulance. Any equipment that is out that we're not going to use, like this cardiac monitor, we can bag it up to prevent any droplets coming into contact with the case. All our cabinet doors are going to be closed, so all the equipment behind here is protected. And then, as you can see behind you, we have pre-cut visqueen and duct tape, which essentially is creating a barrier between the patient treatment area and the front of the cab where our personnel ride. So after we deliver the patient to the hospital to their definitive care, we're going to come back out and decontaminate the back of this ambulance. The people that were in the back, they're still going to have their protective gowns and all the other equipment on, and they're going to start to clean down every exposed surface in this ambulance. So the wipes that you see over here and the spray, they can use this spray on any soft cloth material. These are all EPA certified to kill all bacterias and viruses. And then we have the Sidekick wipes by Stryker. They do the same thing. They'll eliminate any virus on all the surfaces. Truly, we're doing this to protect our community and limit the spread of this virus. Once it becomes a community spread virus, we are an integral part of that chain, and we have a lot of opportunities to cause a break in that chain of that virus spreading. So it's great that we're out there doing what we're doing and hopefully treating people in their home and limiting their exposure to other family members, their neighbors, and other people in the community, and spreading the message that, you know, you're okay treating yourself in home, and we're going to help you do that. But if things get worse, we're absolutely going to take you to the hospital, and we're going to give you the best care we can, and we're going to do so in a way that protects that patient and limits the spread of the virus. And I'm glad that we're responding quickly, and I think we're responding appropriately, and we'll just manage it as it comes.